Hey everybody. Hope y'all are doing well. Today, for the 16th, we are going to talk about the differences between population and public health. Really diving into that population health, or introduction to this concept, which is really, really important in medical sociology. So let's dive into it, shall we? Just a reminder as well that this is the first week of our weekly Moodle prompt reflection. So please make sure you go in to the Moodle page. I'll actually pull that up for you just to show you again where you can find that. So let's go to our courses. Let's go to medical sociology. And so down below, you'll see a couple recordings here for week two. Down below, you'll see week two feedback prompts plus forum. You're going to click into that and you're going to add a discussion to. You're going to pick whatever prompt you want to respond to for 1 to 2 paragraphs. You're going to add a discussion prompt, click the subject. Let's say you choose prompt number 1, the scope and importance of medical sociology. And then you're going to respond to that prompt and you're going to write your prompt in there, post to the forum. And then you're going to see other people's forums in here and you're going to reply to one of them, at least one of them. Okay. That's all you got to do. That's what you need to do by the end of the week, every week, except for I think week 16 is the week that we don't do that. But that's what you need to do. So let's dive into it today, though. Let's dive into public health. So maybe you've heard about public health before, but I want to describe both public health and population health, and we'll talk about their differences today. So public health is a field dedicated to improving and protecting the health and well-being of populations through organized efforts. So through efforts like research, policies, preventative measures. Unlike your traditional clinical medicine, which focuses on treating individual patients, public health aims to prevent disease, to promote health, to extend life at a community or societal level. So that's the connection to sociology too, right? Is that it's a very public facing health. So we're promoting better life outcomes, better health outcomes at a societal level, at a population level, not just at an individual level, like in traditional clinical health. So some 4 key aspects of public health here. So 1, a focus on population. So public health examines the health needs and challenges of entire populations, from small communities to even global regions. 2, public health is prevention oriented. So there's an emphasis on preventing illness, injury, other health risks, actually before they occur. So vaccination campaigns, smoking cessation programs. So getting people to stop in those kind of more problematic health behaviors. 3, the interdisciplinary approach. So public health combines fields like epidemiology, biostatistics, environmental science, sociology, health policy, and behavioral sciences all together and looking at more holistically. And then number 4, health equity and social justice. So public health works to reduce health disparities and ensure that all individuals have access to resources and opportunities to achieve good health. So it's focused on who doesn't have the resources available. How do we provide those resources? What resources are actually needed? Really, that focus on preventative health. I mean, you think about the COVID-19 pandemic, that public health was an everyday topic like it hadn't been in many, many decades. Public health is exceptionally important in things of your individual experience, collective experience, and even public policy. Public health continued here. So some core functions, 3 core functions of public health include 1, the assessment function. So this is collecting and analyzing data to identify health problems and priorities. So example would be like monitoring rates of chronic diseases. That's something that's really integral to public health. So we look at those things. 2, policy development. So this is where you're crafting evidence-based policies to address your public health issues. So maybe it's implementing regulations for clean water is an example of public health. Vaccination policy, an example of public health. And then assurance, number 3, is ensuring that essential health services are actually available and accessible and high quality, right? That not just that there are resources available, but they're good resources. And this is would be like providing immunizations to underserved areas. This is an example of public health, of making sure folks not just have access in general, but have quality access to really good healthcare. That's what public health is looking at. So how do we look at our entire communities and make sure that folks are having the measures, having the access, having the resources that they need? That's public health. And continuing on, public health. There are some key public health activities also that I want to discuss. So number one, disease prevention and control, a really key one. So this is where you're managing infectious disease outbreaks. Think of COVID, think of influenza, think of bird flu, think of these sorts of things that you've maybe heard about. Public health is the area that we're looking at. We're monitoring these things and managing them. Also, here we're promoting vaccination and hygiene practices as an aspect of disease prevention and control. Number two, health promotion. So this is where through public health, we're educating people on healthy lifestyles. Think of nutrition, physical activity, things like that. And also implementing anti-smoking or mental health awareness campaigns. That's all here. We're promoting better health. Environmental health, number three, ensuring that clean air, clean water, and safe food supplies are readily available. That those things that we think maybe environmental practices are directly connected to public health here. So this is even addressing pollution and the effects of climate change on health. Those that seem environmental. Environmental is a huge component of public health. Number four, health policy and advocacy. So developing laws and regulations to improve community health. Things like seatbelt laws or public smoking bans, all are under health policy and advocacy. Advocating for access to affordable health care. All of that is under here. The advocacy piece is huge. And you have to have productive advocacy, to have effective advocacy, you need to understand the specific needs of underserved populations. That's where the diversity and the inclusion pieces come in. And then five, emergency preparedness. So preparing for and responding to natural disasters, pandemics, epidemics, bioterrorism, all these things together. See, the reason why I wanted to include these five kind of key activities here, you can see the scope of public health. There's such a gigantic, huge scope of all the important things that public health encompasses, that public health specialists and officials and our Department of Health and Human Services, whether that at the national level, even at the state level, right? These are really important areas that we're looking at here. And so some examples of public health achievements, the eradication of smallpox, reductions in tobacco use, improved sanitation and access to clean drinking water, development and promotion of seatbelt and helmet laws, advancements in maternal and child health. All these things are examples of great strides that public health has gotten accomplished and that we've achieved. So public health is incredibly important. So why does public health matter? Well, first of all, prevention saves lives, right? So proactive measures like that that we talked about help to reduce the incidence and severity of diseases. You also have the economic benefits. When you preventing diseases actually lowers healthcare costs, boosts productivity. So it's got a direct economic impact. And then global impact. So public health initiatives improve the quality of life for individuals worldwide, addressing disparities and fostering sustainable global development. So it's really, really important. In essence, public health strives to create conditions where people can lead healthy, more fulfilling lives, free from preventable diseases and health inequities. It's critical. Public health is critical to social structure, social ordinance, and in having living productive lives, and in society, in whether it's a global society or a national society or individual communities. Now we also have population health. So let me make sure I'm on the right slide. Population health. There we go. Introduction to population health. So, population health, as you see right up there, population health is the study of the health of a group of people and how social, environmental, and economic factors influence health outcomes. So, similar to public health, and we'll get into the actually specific differences. And this you can think of the reading, the Kindig and Stoddart reading from the 2003 reading here, where they define this definition and scope of population health and how they explain it, particularly how population health looks beyond traditional healthcare systems to include the broader determinants of health, thinking social, environmental, economic factors. That's the key, the critical components of population health is considering those factors, how they influence health. So it's just a quick definition. So population health is the health status and outcomes, again, of a group of people and how those outcomes are distributed within a group. The factors that influence population health include social factors, economic factors, environmental factors, behavioral factors, socioeconomic factors, education, and lifestyle factors. And we're looking at how these things actually impact group and individual health outcomes. So the goal of population health is to improve health for all, and to identify and eliminate health disparities. So whereas population health is looking at how do we get health resources, access, prevention of diseases to the general population, population health takes it a step further and looks at where are there health disparities? Where are populations of color experiencing certain diseases at greater rates than maybe non-people of color? Those are the types of disparities that we're looking at in population health. And so population health professionals use data sets. Remember, we talked about research and research methods in the prior recording. Health disparities within subgroups of people. For example, population health specialists might study vaccination rates within a zip code or compare respiratory illnesses in people who live with a smoker versus those who don't. And we look at those disparities and impacts. And then stakeholders. So improving population health requires the involvement of many stakeholders, including government, providers, healthcare providers, insurance providers, academia, employers, unions, media, philanthropic organizations and individuals, political leaders, all, you name it. These stakeholders are really important for addressing these issues. So some key, from the reading there, some other key points is just specifically that population health focuses on health outcomes across groups and the distribution of those outcomes within a population. Okay. And then it integrates multiple determinants of health. Think of medical care, public health interventions, genetics, social factors, et cetera, et cetera. List goes on and on. And then the important takeaway is that population health emphasizes not just improving overall health, but also reducing disparities. Remember, I mentioned the disparities. Groups of people experiencing diseases or illnesses at different degrees or different rates than others. How do we reduce those disparities? Couple of key components of population health. So number one, focus on groups. So groups can be defined by geographic regions, socioeconomic status, ethnicity, age, race, gender, or other shared characteristics. So for example, even employees in a company or patients with a chronic disease are examples of groups. So that's population health focuses on specific groups of individuals. Again, thinking about that sociological component here. Number two, health outcomes. So the main goal is to improve measurable outcomes such as life expectancy, quality of life, rates of chronic diseases, and mortality rates. Number three, the determinants of health. This is huge, okay? This is going to be really big for us in this course. This is looking at factors influencing health, including social determinants, income, education, housing, behavioral determinants, smoking, your diet, environmental factors, pollution, climate change, and then finally access to healthcare services as well. And we're going to hit on the social determinants of health most specifically in this course, and actually in the coming slides. Health equity as well on number four. This is where this has an emphasis on reducing disparities in health outcomes within and between groups. So we're looking at, again, those disparities component, that equity component. Core strategies in population health. So number one here, when we're thinking about what we're actually doing, number one, data-driven decision making. So in population health, we use data to identify health trends, disparities, and needs within populations. An example could be mapping diabetes prevalence by zip code to allocate resources more effectively. Data-driven is important. Two, integration of healthcare and public health. Here we're bridging gaps between healthcare delivery. Think of hospitals, right? Your traditional hospital setting. Bridging the gap between those, the healthcare delivery and preventative public health measures like community health initiative. So we're integrating both of those things, thinking broader. And three, a focus on prevention. So addressing root causes of disease and illness through interventions like improving housing, reducing pollution, and promoting healthy behaviors. And then finally, collaboration across sectors. So we're in population health, we're engaging healthcare providers, policymakers, community organizations, and businesses to address broader determinants of health. We're connecting and collaborating across this interdisciplinary model is what population health is. Couple of examples of population health initiatives. So reducing obesity. So maybe implementing school-based nutrition programs and creating walkable community spaces. Managing chronic diseases, so providing coordinated care for diabetic patients, focusing on diet, medication adherence, regular screenings, preventative care. Health equity efforts, so expanding access to healthcare in underserved rural areas through things like telemedicine, right? Well, maybe a doctor can't be present right there. There's a lack of doctors actually physically present. So how do we advance telemedicine opportunities and access there? Addressing the social determinants of health as well. So this is where we're initiating affordable housing projects to reduce health risks associated with unstable living conditions. This is one example of what that can look like. So there's countless examples of population health initiatives, but they're really important because we look at things beyond, remember the sociological imagination. We look at things beyond just the individual experience. What are the things taking root from those experiences? What are the things contributing and causing and impacting why those experiences are actually happening? And why is population health important? Well, you're going to get improved health outcomes. So focused interventions lead to more measurable improvement. Things like lower rates of chronic disease or better maternal health, for example. Cost efficiency as well. So preventing illness, like in the public health importance section, reduces healthcare spending, improving economic sustainability. Health equity is hugely important as well. So identifying and addressing these disparities that we're talking about ensures more equitable health outcomes for all population segments. If you improve healthcare access over here, you're improving general healthcare across the nation, across the groups. And then for ailment with healthcare, alignment with healthcare reform. So population health aligns with goals like value-based care, person-centered care, emphasizing quality over quantity in healthcare delivery. That we know we need much better preventative care. We know we need much better access. So when we focus on quality of care, we're impacting all of these things. So in summary, population health is a very holistic approach that integrates healthcare, integrates public health, and integrates the social determinants of health to enhance the health of specific groups while addressing inequalities. So this makes it a really critical aspect of achieving sustainable and equitable healthcare systems. And I want you to really focus on those words, sustainable and equitable. Those are what we're focusing on in population health. That's the goal. Our healthcare systems need to be sustainable and equitable. So we've talked a bit about both, right? We've talked about public health, population health. Let's talk about a couple of the differences here. So again, we've looked a little bit about on each, but let's talk into the specifics. So public health efforts are often government driven and target specific health issues. Think of like infectious disease control, vaccinations, things like that. Population health, on the other hand, looks at a broader set of determinants and is interested in the health outcomes of specific groups, including disparities across those populations. Again, you can think more in the Christensen, the 2016 reading about improving population health and enhancing the patient experience, reducing per capita costs of healthcare. I also just a couple of additional quick notes. So it's just about what public health professionals do. Again, it's preventing disease, promoting healthy lifestyles, detecting and responding to infectious diseases, promoting healthcare equity and access, and then limit health disparity. So public health is critical, right? But population health is taking that broader, more interdisciplinary, group-focused components. And let's talk a little bit again. You see that the differences here. Public health is the science of improving and protecting the health of communities and population. And then, unlike the broad scope of public health, population health zeroes in on targeted interventions tailored to specific communities or population groups. The approach of population health considers a range of determinants, including social, economic, environmental, and behavioral factors that affect the health of these groups. So you're starting to see the differences a little bit. I'm going to lay it out for you in terms of a table. And so let's dive into that right now. So if you think of population health versus public health. So here you see on the table, let me get my cursor to make sure I can annotate here. Here we go. So you see the aspect. That's going down. So focus of each, scope of each, methods of each, and goals of each. And you see public health and population health. So let's go one by one here. Let's go to the focus of public health versus population health. So the focus of public health, health of the community or society at large, versus the focus of population health, health of specific populations or subgroups. Okay. Scope of each. Scope of public health would be preventative measures and policies for the public. The scope of population health would be broader, incorporating healthcare delivery. And then methods of public health versus population. Methods of public health would be community-focused programs and policies there, whereas the methods of population health would be data-driven strategies across healthcare, across public health, across social sectors. And finally, the goals of each. So the goals of public health is to promote health and prevent disease in our communities, right? And then the goals of population health is to improve outcomes and reduce disparities across and for specific populations. So think population health, those specific groups, those specific populations. Public health tends to be more broad, community focused, community wide. Okay. We don't have an activity because we're not actually meeting in person, which is a change from the original course structure at times. But I wanted you to think about what factors might influence population health in your communities, and maybe take a chance to, that's the second discussion prompt option for this week, is maybe think about that and respond to that prompt in that way think about factors that might influence population health, right, in your community. What are the things that are specific maybe to your community or groups that you're involved in, that community groups that impact health delivery, health outcomes. Policies and politics shaping U.S. population health. So the only thing I wanted to mention here is this is from the Montes reading from 2021. We're really connecting population health to real world policies. So I encourage you to really dive into this reading, look at policies, politics, and profits, and how that impacts population health. So what the reading does is focus on government decisions and how those impact health outcomes and disparities, particularly in the United States. So just some key points from the readings that I wanted to point out is that U.S. population health is heavily influenced by policies that shape economic inequality, labor markets, social safety nets, and healthcare access. It's so interconnected. Political decisions also are often prioritize profit and economic growth, sometimes at the expense of population health. And then finally, just an example that they provide is that the decline in life expectancy in the U.S. in recent years can really be traced to policy changes that have weakened social supports for lower income populations. You wonder why our life expectancy is reducing. It's because there are economic policies that have really worked against it really gone to the expense of population health. So those are some key points from the readings. That those are the things that population health needs to look at, right? Is that we're looking at the economic side in addition to the social determinant side. And how are those things interconnected? Just a couple of last things here. When we think about the social determinants of health and their impact on population health. So the social determinants of health, that's what SDOH down there stands for, are the conditions in which people are born, grow, live, work, and age, and they are shaped by the distribution of money, power, and resources at global, national, and local levels. So we know that, right? You've seen that in the readings. I was just talking about that. But these are think of the social determinants of health as the non-medical factors that impact your health and longevity. So again, examples are your income, job, education level, even your zip code, your geographic location. Many social determinants of health are out of your control. And some key social determinants of health and that I wanted to include here, these 5: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and then social and community context. So let's just describe each of these at a high level quick. So economic stability, access to steady income, access to employment, access to financial security. These things influence the ability to afford things like nutritious food, effective housing, good quality healthcare, directly impacting your health outcomes. Number 2, education access and quality. So higher levels of education correlate with better health literacy, healthier behaviors, and improved access to healthcare. It's really important piece there, that education piece. 3, healthcare access and quality, proximity to healthcare facilities, availability of insurance, and cultural competence in care significantly shape health outcomes. So you have healthcare, or you have access to healthcare facilities and availability of insurance that allows you to have access to medical professionals that understand cultural nuances that maybe of your culture or your individual, that really access that person-centered care. That's really important as well. 4, neighborhood and built environments. So safe housing, clean air and water, access to recreational spaces. All these things contribute to physical and mental health, improved outcomes. And then finally, 5, social and community context. So social support, freedom from discrimination, stable relationships. All these things promote well-being and mitigate stress. So this is how we see the social determinants of health. These are social factors, right? But they all contribute to health-related outcomes. That's the point here. And the social determinants of health are critical in shaping health disparities in overall population health. For example, individuals in low-income communities often experience higher rates of chronic illness due to limited access to nutritious food and safe environments. And also structural discrimination such as systematic racism and gender inequality. These things exacerbate health inequities for marginalized groups as well. So these are the things in population health and medical sociology we're really taking a keen interest in, because we want to see how these social factors are negatively and positively impacting health outcomes. It's really, really important. And so some key importance of addressing social determinants of health, again, improving population health, reducing disparities, and enhancing economic and social resilience. It's really, really critical that we look at these things. They're really, really important. And this is going to be such a huge through line for all of medical sociology. So really familiarize yourself with the social determinants of health and their impacts on population health. This is really a critical component. And we have a discussion prompt that's related this week. Finally, just some key summaries here that you can take a look at. Population health is a comprehensive approach to improving health outcomes and reducing health disparities. Again, looking at specific populations, specific groups in our communities. Population health involves addressing a range of factors beyond healthcare, including social services and policy. Things like mental health services, disability services, and access. And then both social determinants of health and political decisions significantly impact population health. Okay. That's really the last thing. The final thing is just a reminder again, I've already mentioned a few times, but complete your Moodle prompt reflection by the end of the week and respond to at least one other student's discussion prompt. Other than that, I'll stop sharing here. Please let me know of any questions you have. You can email any questions, anything you need, let me know. But I'm really looking forward to seeing your discussion prompt reflections. Thanks, everybody.